Thank you, Dr. Srinivas, and thank you, Chitra ma'am and ARC and AIOC for giving this opportunity, and great presentation, Dr. Vaishali. So today I was told to talk about or defend, let me press this button, okay, to defend LRIs and AKs in low-grade astigmatism correction of cataract surgery. Or in a way, I'm supposed to talk against toric for all patients of low astigmatism in cataract surgery. As you can see, there's a very significant number of low grade of astigmatism in pre-op patients. But since we are living in India, majority, or let's say 20% of are below poverty, and 17% are in the lower caste category. So are we justified to push all these patients for toric IOL? I really don't think so. Is there an alternative with no extra cost? This is where the LRIs and AKs come into picture. Now, why is it advantageous? There is absolutely no extra cost for the doctor and the patient, so they don't feel the pinch. Secondly, once we do it, we we give them much better vision for distance, and they don't require the glasses for distance, and also they can get rid of bifocal glasses. And in fact, if you do the monovision in the other eye, in fact, the patient won't even require near glasses. I don't have the data for India, but the spectacle lifetime expenditure in the US for an average person is $2,100 to $3,400. And in Europe is about $1,700 to $4,600. Now, the next thing is, believe me, the patient satisfaction is absolutely amazing in these patients when you do the LRIs and AKs, because the expectations is very low, and they are absolutely free. They're not paid any cost. But it's not so in patients who choose toric IOL, because their already expectations high, and they feel like it's their birthright because they paid something. They feel like they should get 100% get rid of the astigmatism. So to satisfy these patients, if something goes wrong, is very, very difficult. Now, the next thing is, please, I want to tell the point that we are doing this free of cost. So it's almost like we are doing a service to the community. And when we do this, the gratitude these patients have for you is completely, unmeasurable than any other patients, or if you do a toric patient who really can afford for it. So the next thing is, even if you look at middle-class patients, and if they do take out from their savings and go for a flak surgery, again, asking them to shell out, money for a toric IOL when they have low grade of astigmatism, I feel, pretty guilty for it. You can always suggest it, but you cannot force it, definitely. So now let's look at the different error points. Now, when we look at error things, means the points where things can go wrong. Now, when we look at the LRIs and AKs, there's always a chance of incorrect scans, calculation errors, marking errors, depth of incisions, and also there's a chance of regression. But when we look at the toric IOL, we have multiple factors. So we have inadequate K readings, incorrect calculations, improper patient selection. Then there's always a chance of inadequate pre-surgical marking, defective capsular access, misalignment of IOL cylinder. And also post-surgery, there's a chance of rotation because of retained viscoelastics. And the ratio between the capsular bag and IOL is not good. Then there's a chance of rotation, or it can happen because of hypertonia or overinflation of the bag. So if you just look at pure factors, there is lesser factors in LAs, LR and AKs as compared to the toric IOLs. But this, I want to stress the fact that this doesn't mean any of the procedure is more superior. I'm just trying to say is there are many, many factors which you have to take into counter. This is one of the reasons why there is a high variability in toric IOL surgeries. When you look at unilateral, there's about 60 to 85%, which a lot of studies suggest that. And also when you look at bilateral, it ranges from 69 to 70. 69 to 97. So I would like to conclude by saying, is it right to push all lower grade of cataract surgeries for toric IOL? I would really disagree. I would believe if the patient is affordable, if the astigmatism is 0.75 or more, then you can always go for a toric IOL. But if the patient is not affordable, which will be in majority of our cases, please do not push or ask them to shell out more money. Always go for a free LRI, AKs or OCCI or even CCIs. This way you're doing a free service to your community, and and the blessing that you will get of free service is completely unmeasurable. So at the end, I want to say that the best way to find yourself is to lose yourself in the service of others. Thank you for your time.